So good morning, myself Priya and I am from Kanpur. I am working as a nursing tutor in Rama College of Nursing. So today is our topic. Today we are going to discuss about the tuberculosis. So first we will discuss about the definition of the tuberculosis. So what is a tuberculosis? Tuberculosis is an infectious disease. It is a infectious disease. It is a infectious disease which is occur in respiratory system and the causative agent of the tuberculosis, that is mycobacterium tuberculosis. Now what is a tuberculosis? Tuberculosis is an infectious disease of lung parenchyma. Lung parenchyma is present in our respiratory system, and the causative agent of the tuberculosis is a mycobacterium tuberculosis. So definition is tuberculosis is an infectious disease of lung parenchyma. So the question is arises is what is parenchyma? So parenchyma is the portion of the lungs that helps in gaseous exchange. So primarily it affects only lung parenchyma. Later on, or it may be spread from the lungs to another parts of the body, another parts of the organ. Suppose your patient is having a lung tuberculosis, it may also spread to the kidneys or to the bones, or you can say central nervous system. Central nervous system, it consists brain, spinal cord and meninges and many more. So this is a definition of the tuberculosis. Next we will discuss about the types of tuberculosis. So there are mainly two types of tuberculosis, that is latent and active. Now what is the meaning of latent? The term latent is defined as the person is having a tuberculosis bacteria, in his or her body, but the bacteria is not active. Bacteria is not active. When the bacteria is not active, so there is no symptoms. So there is no symptoms of tuberculosis. So there is no symptoms of tuberculosis. And inactive, in this bacteria is active, which is causing tuberculosis and making you sick, and symptoms are present. This is the difference between latent and active TB. Next we will move towards the etiology. Now what is the etiology? What is the meaning of etiology? Etiology is just a cause. What is a cause? What is the cause behind why the patient is having tuberculosis? So as I already told you that it is a causative agent. Causative agent of tuberculosis is mycobacterium tuberculosis, which is a gram-positive bacteria. It is a gram-positive bacteria. And how it is spread? It is spread via droplets Because it is an airborne disease. Suppose if the person is infected, suppose the person is infected with the tuberculosis, and you are continuously you are in the contact with that person whenever he speaks, he sneezes or coughing, you are in the contact with that person, so you may get also these diseases. Next, we will discuss about the risk factors. What are the risk factors? Now, what is the meaning of risk factors? Risk factors are just who are more prone to get the infections. Who are more prone to get the infection. So, first of all, in a direct contact, with the person who is deceased or who is already infected with the tuberculosis. And the another one is immunocompromise. Now, what is the meaning of immunocompromise? When the patient is having a low immunity, when the patient is having low immunity, for example, if the patient is very older people, suppose the patient is having any kind of malignancy, so their immunity level is already low, so they might get infection easily. And that's what is the another one? Pre-medical diseases. Now, what is a pre-medical diseases? Pre-medical diseases, suppose patient is already having a diabetes, mellitus, or hypertension, or hypothyroidism, or hyperthyroidism. So they can easily affect by the tuberculosis. And the another one is person who are taking alcohol, who are consuming alcohol or drugs, or in such rural areas when they don't have the adequate knowledge, when they don't have the adequate knowledge regarding the disease, and how to prevent from the disease. So these are the risk factors of the tuberculosis. Next, we will move towards the clinical manifestations. Clinical manifestations of the tuberculosis. So first of all, patient is having a fever, which is especially in late afternoons. Another one, patient is having weight loss and anorexia. What is the meaning of anorexia? Anorexia is just a loss of appetite. Anorexia, dyspnea. Dyspnea is a difficulty of breathing. And the another one is hemoptysis. What is hemoptysis? Hemoptysis is a just presence of blood in the sputum. Hemoptysis meaning presence of blood in the sputum. And the another clinical manifestations are patient is having fatigue or malaise. So these are the clinical manifestations of tuberculosis. And the another one is patient might be having chest pain, and it will be characterized by when the patient is having dull or tight chest pain. Next, we will move towards the pathophysiology of the tuberculosis. So, due to etiological factor like factor could be anything, reason could be anything. Due to etiological factor, it leads to entry or you can say entrance of the bacteria, which leads to through the airways, it will be transmitted in the alveoli, alveoli. It will be transmitted in the alveoli, which leads to decomposition and multiplication of the bacteria, which leads to decomposition and multiplication of the bacteria. Next, another one is uh, through the blood stream, through the blood stream or lymph nodes, through the blood stream and through the lymph nodes, it can be goes to the another organs of the body. So that is a pathophysiology which is very simple due to etiological factor. Factor could be anything. Due to etiological factors, there is a entry of the bacteria which through the airways, which leads to through the airways, it will be directly going in or transmitted in the alveoli, which leads to decomposition and multiplication of the bacteria. After this, through the blood stream or through the lymph nodes, it goes or it occurs or it is spread into the another parts of the body or another organs of the body. So that is the pathophysiology of the tuberculosis. So next we will discuss about the diagnostic evaluations of the tuberculosis. First, what we will do, diagnostic evaluation. First we will do history collection and physical examination of the patient. So whether you are doing a physical examination of the patient, you can see the swollen and tender lymph nodes. Next, we can do chest X-ray. And the another one is for the confirmation of the TB, we can do a Montague's test. So in diagnostic evaluation, first of all, what we will do, we'll do history collection. Then we will do chest X-ray. Then after, for the confirmation of tuberculosis, we can do a Montague's test. In Montague's test, we administered a purified protein derivative, that is PPD, 0.1 ml transdermal, and it results come within 48 to 72 hours. 48 to 72 hours. And the another one test we can do, that is QFT gold test. It's a simple blood test which detects or to confirm Mycobacterium tuberculosis. Another we can do bronchoscopy. So what is bronchoscopy? Bronchoscopy is just a visualization of bronchioles. So these are the diagnostic evaluation for the tuberculosis. So next we will move towards the management. Management of tuberculosis. So in management, we do a pharmacological management. There is a anti-tuberculosis drugs which are provided for 6 to 12 months. So there is a mainly two lines, first line drugs and the second line drugs. So what is the difference between first line drugs and the second line drugs? So there is a first line drugs. So there are some examples of the first line drugs. First one is isoniazid, pyrazinamide, ethambutol and rifampicin. And there are some examples of the second line drugs, that is rifabutin, rifapentine, amikacin and streptomycin. So this is a management of the tuberculosis. These are the anti-tuberculosis drugs, which is further divided into two parts, first line drugs and the second line drugs. What is the difference between first line and the second line, which I have already told you? In first line drugs, these are some drugs. First one is isoniazid, pyrazinamide, ethambutol, and the rifampicin. And the second line drugs, there is rifabutine, rifapentine, amikacin, and the streptomycin. Or one more is there, that is levofloxacin. So this is a pharmacological management for the tuberculosis. Next, we will move towards the DOTS. What is DOTS? DOTS is a direct observation treatment short course which is organized by the WHO. According to WHO, it's a low cost effective treatment for the tuberculosis patients. So there are some components of the DOTS. Suppose the first one, their component is centralized system of detecting tuberculosis, and the another one is regular supply of drugs, and the another one is recording and reporting, and providing a standard treatment. So these are the components of the DOTS. DOTS is launched by the WHO. So next we will move towards the nursing management. So in nursing management, what we will do, we will make a prioritize nursing diagnosis for the patient, and we will make an intervention plan for this. Okay. So first of all, patient is having a difficulty in breathing. Patient is having a difficulty because the patient is having a disease of the lungs. Okay. So first diagnosis is patient is having a difficulty in breathing. So first one is ineffective breathing pattern. So what are the interventions? First of all, we'll have to provide a comfortable position to the patient. We can provide us semi-Fowlers or Fowlers or sitting positions for the patient. It will lead to proper expansion of the lungs. Another one, what we will do, we will provide a supplemental oxygen or supplemented oxygen to the patient. Another we can do, we can ask the patient for the deep breath exercise. And the another one, patient is having dyspnea and patient is having cough. So another one is ineffective. Another nursing diagnosis is ineffective airway clearance. So the airway of the patient, airway is not clear, there is a sputum, there is a cough. So what we will do, first of all, we will provide a comfortable position to the patient. We will ask the patient to expel all the cough or mucus. And another we can do, we can ask the patient for a regular breathing exercises. We can ask the patient for increase the fluid intake. We can ask the patient for increasing the fluid intake. And what is the another one diagnosis? In clinical manifestation, we have already studied patient is having anorexia. So what is the meaning of anorexia? Anorexia is a loss of appetite, like patient is not feeling to have anything or eat anything, which leads to altered nutritional pattern. So what are the interventions? Interventions will be, you'll have to ask or you'll have to encourage the patient to eat, or another you can ask for the patient for his likes and dislikes. Another you can ask the patient for increasing consumption of fluid intake, or you can ask the patient for taking a frequent and small meals. So these are the nursing diagnoses. We made 3 nursing diagnoses. First one is ineffective breathing pattern, and the another one is ineffective airway clearance, and the another one is altered nutritional pattern. So this is the nursing management of the tuberculosis. Next, we will summarize our we'll summarize our topic. So today we discuss about the definition of the tuberculosis. What is tuberculosis? What are the types of the tuberculosis? What is the etiology, like what are the causes? What is the causative agent of the tuberculosis? Another, we discuss what is the risk factor. What are the risk factors? Risk factors means who are more prone to get the infections. Next, we discussed about the clinical manifestation, pathophysiology, diagnostic evaluation, management and DOTS therapy, and the nursing management of the tuberculosis. So the topic is finished. I hope that you all get the effective knowledge regarding this topic. Thank you.